You're here to see Dr. Parr. Okay. Name, please. Okay. Let's see here. Name is... And what time is your appointment with Parr? Okay, 9:30. Let me see. Let's see here. Alright. Okay, well, thank you for checking in. You're all set. I do have you here to see Dr. Parr at 9:30 this morning for a full cranial nerve exam. Okay, and when's the last time you saw Dr. Parr? Okay. So, 3 months ago. Alright. Is there anything you'd like me to add to the notes for Dr. Parr? Okay. So, still recovering. And some left eye floaties. Okay. Alright, so you're all checked in. Dr. Parr seems to be running on schedule this morning, so she'll probably come grab you right around 9:30, okay? I just have some patient forms for you to fill out while you're waiting, so let me just make sure I have all of them here. So we have the insurance form. And we have general questions. And the mental health form. So I'm just gonna circle the important questions, okay? So, for the insurance, we'll need the number, the expiration, name on the card, and your initials or signature. Okay, allergies. For the mental health sheet, there are just 2 on here. So we have the current state and medication and signature and initial. Alright, so you can just work on filling these out while you're waiting, and it is 9:29 right now, so any minute she'll be calling you back, alright? Just see here. Let's see. So hi there. You're my 9:30, right? Yes. How have you been? Recovery still going well? Great. That's great to hear. So I'm sure you remember me. I am Dr. Parr. I'm just going over your information here. So, the receptionist told me that you have been having a little bit of trouble with the left eye. So, with your kind of accident, that is normal. It can be just healing. While it's healing, it can cause some floaties and some irregular symptoms. But other than that, I don't see anything on your chart. So you did do the cranial nerve exam 3 months ago. So it won't be anything new. We're just gonna do it again to make sure that you are healing as you should. So the accident was, I believe, 8 months ago, right? Yeah, so you're healing wonderfully, but this is just a preventative thing. So nothing to worry about. I'm gonna take excellent care of you. I'm gonna leave my gloves on for just a few of the tests. So I'm gonna start by just taking a listen to your heart, making sure that ticker is working as it should. So let me just take a peek here. So alrighty. Okay, sounds good. And over here. And over here as well. Okay. Now for the other side. Looks good. Okay. So, heartbeat sounds normal. It's always good. So, okay. So, for your first test, we are gonna do the taste test. Okay. So, I don't know if you remember from last time, but we are gonna test your taste buds because they are connected to the cranial nerve. So this is a mixture of 2 different flavors. So what you'll be looking for is strawberry and grape. So I just want to make sure that you can distinguish between the two. So these are just calcium carbonate tablets. We have a strawberry and a grape. I'm just gonna have you go ahead and close your eyes and open your mouth. I will place one on your tongue, one of these colors, and once you've got the flavor in your mouth, just let me know which one you think it is. Really easy. And once you have it, you can feel free to just spit it out and throw it in the garbage. Okay, so close your eyes for me. Close your eyes. And I will give you the first flavor. So. Do you have any idea? Grape. Excellent. Yes, it is grape. Yes. Okay. And this next one here. Does it taste different? It tastes like strawberry. Well, you are 100% right. Yes. So taste buds are good. Okay, thank you for participating in that. So last time you failed that, and this time you've passed with flying colors. So that is a great sign that your cranial nerve is working much better this time around. So pat yourself on the back, you're doing amazing. So next we are going to move on to the scent test. So your cranial nerve sends signals to your sinuses and all of the cells inside of your nose. So sometimes if there are issues with the cranial nerve, you may have issues distinguishing certain smells. Okay, so this test is maybe a little bit tricky. A lot of my patients fail, but it's no worries, okay? If you fail, we'll just try again in 3 months, so no pressure. I do have 3 different scents for you to try. Maybe just close your eyes while I'm holding it up to your nose, because there are labels on the bottle. I am going to take my gloves off now that we've done the eating part of the exam. My hands have been double washed, so they're very clean. But now that we're done with the edible portion, I am just going to remove them for the rest of the exam. So we'll go ahead and get started with the scent test, okay? So if you don't mind, just close your eyes. And I'm going to place this under your nose, just like this. And give it a whiff and let me know what scent that reminds you of, okay? Yeah, I can even I'll let you smell the fully concentrated version. Yeah. Very good, very good. Yeah. So this one is vanilla sandalwood, and you did pick up on the sweet notes, so I call that a win. So let me just see here. So vanilla sandalwood. Pass. Okay. On to the next scent here. So you can just go ahead and let me know what this smells like to you. Yes, very good, very good. This is a hard one for a lot of my patients. Excellent job. So, you were able to identify the sour apple, that can be a really tricky one, so that you did amazing. Even sometimes people without the cranial nerve damage mess that one up, so. Alright, my love, so final scent test. You're passing with flying colors so far. So, I'll just go ahead and let you smell the fully concentrated version. So, just let me know what that smells like to you. Wonderful, yes. So, you did pick up on the spicy notes, and that is pretty much all I'm looking for. It was a mixture of cinnamon and cayenne, so the spiciness is correct. Okay, you're doing so great. So, alrighty. So for this next test, I am going to be testing your sensitivity to light. You remember this one? Yes. So basically, I just have a light here. As you can see, I just have a light here, and it shouldn't hurt your eyes, so you can feel free to look right at it. And what I'm going to be doing is seeing whether or not you can follow the light. So I want you to do so without moving your head as best you can. So I'm just going to have you follow the light with your eyes and not your head. So, I'll go ahead and start. So, just follow the light. Follow the light. Follow the light. Keep following the light. Keep following the light. Okay. So that was amazing. I'm going to make it a little bit more tricky. So we're going to do the same thing that we just did, okay? But when it becomes out of your range of vision, I want you to just stare at me. I want you to follow the light, and then as soon as you can no longer see the light, I want you to direct your attention to my eyes instead. So instead of turning your body to try to follow the light, I want you to just follow it until it's out of your frame of vision, and then look at me. Got it? Okay, I'm sure you're gonna do just great on this test as well. Okay, so here we go. Are you ready? Okay, so just follow the light. Follow the light. Follow the light. Ooh. Good. Follow the light. Follow the light. The light, the light, the light. Back at me. Excellent. Okay, darling, you passed that with flying colors. So, vision and light sensitivity looks normal, in terms of the eye floaties, I can give you a recommendation for a specialist. I can recommend a few in the area for you for your eyes. But if I were you, and this is just my opinion, I would come back for your appointment in the next 3 months and give me an update then, because I have a feeling it could heal up on its own. But if it's very bothersome for you and you want to get it checked out, I can definitely give you some recommendations for a specialist. Yes, I do believe that when you come back to see me, you will be feeling a lot better, because it's just a common side effect of the injury that you had. So I would guess that you should start to heal in that left eye, hun, okay? Okay, so there's just one final part of the test today. So it is the sharp or dull test. So this is really testing for nerve damage in the face. And I know you did it last time, but I'll just remind you. So this is a derma roller. Now, these can be painful if you press down, but I will not be pressing down with any pressure, okay? So what I'm going to do is just roll it in certain areas of your face, and you're going to have your eyes closed. I promise I'll finish up. This won't take much longer, okay? And I also have a brush. So this is a sterilized brush, brand new. And the brush feels very soft. So if you'll just give me your hand. Okay, so let me demonstrate on your hand. So that's the soft brush. Yeah. And this is the sharp roller, okay? So that's what you can expect to feel on different areas of the face. So of course, if you leave your eyes open, you'll be able to see what I'm using. So just for that reason, I'll have you close your eyes, and while we're at it, let's take a deep breath, okay? Let's breathe in the healing, okay? And breathe out all of the trauma. Sometimes just taking a deep breath can be very healing. Okay, so let's I'll just have you close your eyes, okay? Close your eyes. Close your eyes. And just let me know once you feel anything on your face. Just let me know if it feels soft or sharp, okay? Alright, here we go. I'm gonna start right here. Soft, that is correct. And I'll go over here. Soft again, yes, you were not tricked by that one. And I'll go on the chin here. That is soft, yes. Okay, let's try this one here. That is sharp, excellent. Okay, let's try over here. Yes, yep. And over here. Sharp, yes. And one more just for good luck. Soft, yes. Okay, you can go ahead and open your eyes. round of applause. You got all correct. All correct. All correct. So, no nerve damage here. It's looking like you are healing up nice. Okay, so nerves 100% pass. Okay, so I do have the referrals here. So we have Dr. Bronner. He's in the metro area. He's great. You could go to your regular eye doctor as well, but I do have these guys are specialized in trauma. So we have Dr. Bronner, we have Dr. Amita. She's sweet, she's very sweet. And we have Dr. Shuns. Okay, so these three are great. If you want to give them a call, just let us know, okay? So call Betty at reception, just give her a call, and I will put in a word so that you can get an appointment sooner, because a lot of times these really sought out specialists have long wait lists. But if you call our office first, I will email them or call them directly and make sure that they fit you in, okay? Of course, absolutely, I would love to. So yeah, I will give these to Betty up at reception, and unless you have anything for me, I think that you are good to go. So just keep doing what you're doing, physical therapy, resting your eyes after a few hours, and just trying to rest as much as possible. Your body really knows what to do, so try not to stress too much about healing, and I will see you again in 3 months.